Welcome to my YouTube channel, Elite Health Tips. Most people think diabetes begins with a diagnosis, a blood test, a doctor's phone call, a prescription bottle sitting on the kitchen counter. But in reality, diabetes often starts much earlier, and the first warnings can appear in a place most people never think to check: your feet. Right now, at this very moment, your feet may already be trying to tell you that something inside your body is changing. The problem is that the signals are quiet, easy to ignore. Easy to blame on age, tiredness, bad shoes, or long days. But what if those small changes are actually early clues that your blood sugar has been silently rising for years? Dr. Franklin has spent more than 2 decades treating adults over 55, and over the years he noticed a pattern that kept repeating itself. Long before patients were officially diagnosed with type 2 diabetes, their feet had already been sending warning signs. Tingling, burning, cracked heels, tiny wounds that refused to heal. The body was speaking, but nobody was listening closely enough. And that realization is exactly why this conversation matters. A few weeks ago, a 71-year-old woman named Gloria came into his office. She lived alone, stayed active, cooked her own meals, and still worked in her garden every morning. By all appearances, she looked healthy. But near the end of her appointment, she casually mentioned something strange. At night, her feet tingled. The skin on her heels kept cracking no matter how much lotion she used. And there was a small sore on one toe that simply would not heal. When Dr. Franklin examined her feet, he immediately recognized several early warning signs. Blood tests later confirmed the truth. Gloria had been living with uncontrolled type 2 diabetes for nearly 3 years without knowing it. The clues had been visible the entire time. And that brings us to the very first sign people overlook more than any other: tingling or pins and needles sensations that appear for no obvious reason. Almost everyone has experienced a foot falling asleep after sitting awkwardly for too long. That temporary numbness usually disappears within seconds after moving around, but diabetic nerve damage behaves very differently. This tingling often shows up at night while lying in bed or first thing in the morning before the day has even started. Nothing is pressing on the foot. Nothing explains the sensation, yet the buzzing remains. What's happening inside the body is far more serious than most people realize. When blood sugar stays elevated for long periods of time, it creates a toxic environment for the nerves, especially the long nerves running all the way down to the toes. These nerves rely on a protective coating called myelin, which helps electrical signals travel smoothly. High glucose slowly damages that protective layer. Once the insulation begins breaking down, nerve signals become distorted. The brain starts receiving scrambled messages, which show up as tingling, buzzing, or prickling sensations in the feet. Dr. Franklin often compares it to listening to a radio station with heavy static. The music is still there, but the signal is distorted. Your nervous system experiences something very similar. The messages are being sent, but they arrive corrupted. According to neurological research, nearly 70% of people with diabetes eventually develop some form of peripheral neuropathy, and the feet are usually the first place it appears. The dangerous part is that many people dismiss these sensations for years. They assume it's aging, poor circulation, sitting too long, but the earlier nerve damage is detected, the more likely it can be slowed or even partially reversed. That's why awareness matters so much. One simple habit can help immediately. Every night before bed, spend a few minutes rolling your feet gently over a tennis ball. Slow movements across the arch and heel help stimulate blood flow and increase awareness of changes happening in the feet. Most importantly, it creates a daily moment where you actually pay attention instead of ignoring what your body is trying to say. But tingling is only the beginning. The next warning sign is even more disturbing because it often robs people of sleep long before they understand what's happening. Many patients describe it as feeling like their feet are literally on fire in the middle of the night. And what causes that burning sensation may surprise you even more. Why burning feet at night could signal early diabetic nerve damage, why some wounds refuse to heal, and how small everyday habits may quietly be putting your feet at risk without you realizing it. And before you move on, take one quick look at your own feet tonight. Sometimes the smallest clues reveal the biggest problems. Imagine climbing into bed after a long day feeling completely normal, only to wake up an hour later with your feet burning so intensely that you throw the blankets off searching for relief. For many older adults, this becomes a nightly battle. At first, they blame their shoes, the weather, or standing too long during the day. But over time, the pattern becomes impossible to ignore. The burning returns night after night, especially in the soles of the feet, even when the room is cool and nothing seems physically wrong. And this is where many people unknowingly miss one of the earliest signs of diabetic nerve damage. Dr. Franklin explains that this type of burning sensation is often linked to something called small fiber neuropathy. Inside the nervous system are tiny nerve fibers responsible for sensing temperature and pain. These delicate fibers are heavily concentrated in the feet, particularly along the soles. When blood sugar remains elevated over months or years, these nerves begin malfunctioning. Instead of correctly reporting what the body is experiencing, they start sending false signals directly to the brain. The brain receives a message that says heat, even though no actual heat exists. It's similar to a faulty alarm system that suddenly starts going off in the middle of the night without a fire. The danger isn't real, but the warning feels completely real to the person experiencing it. That's why so many people describe their feet as feeling hot, burning, or painfully sensitive even while touching cold sheets. Medical studies published in neurological journals have shown that small fiber nerve damage can appear years before someone officially qualifies as diabetic on standard blood tests. In other words, the feet may begin warning you long before a diagnosis ever happens. That's what makes these symptoms so important to recognize early, instead of dismissing them as part of aging. One of the first things Dr. Franklin recommends is surprisingly simple. Before bed, soak your feet for a few minutes in room temperature water. Not ice cold, not hot, just neutral temperature. This helps calm irritated nerve endings without overstimulating them further. He also advises reducing refined carbohydrates during the evening hours. Foods like white bread, sugary drinks, pasta, and processed snacks can cause blood sugar spikes overnight, which may worsen nighttime burning sensations. Many patients notice improvement within weeks simply by changing their evening eating habits. But while burning sensations are uncomfortable, the next warning sign is far more dangerous because it can quietly lead to serious complications if ignored. A small cut, a tiny blister, a wound that should heal within days, but somehow remains there week after week. This is the moment where diabetes often shifts from hidden to truly dangerous. Dr. Franklin remembers a patient named Robert, a 69-year-old man, who stepped on a tiny piece of gravel while walking barefoot outside. The puncture wound was small, barely noticeable. He cleaned it, covered it, and forgot about it. But 4 weeks later, the wound was still open. Worse, it had become swollen and infected. By the time Robert finally came into the office, the infection was already spreading deeper into the tissue. Fortunately, treatment started just in time. A few more weeks of delay could have resulted in permanent damage or even amputation. The reason diabetic wounds heal so slowly comes down to blood flow and immune fairness. Healthy blood carries oxygen, nutrients, and infection-fighting cells to injured areas. But when blood sugar stays high for long periods, blood vessels begin narrowing and stiffening. Less oxygen reaches the wound. At the same time, white blood cells lose efficiency, meaning the body's natural repair system weakens exactly when it's needed most. Dr. Franklin often compares it to a road repair crew trying to fix a damaged highway while traffic blocks every entrance ramp. Supplies arrive late. Workers can't reach the site efficiently. The damage worsens because the repair process slows to a crawl. Inside the body, that's exactly what happens when diabetic circulation problems interfere with healing. Global health organizations report that diabetic foot complications remain one of the leading causes of preventable amputations worldwide. And the frightening part is that many of those severe complications begin with wounds so small they initially seem harmless. That's why weekly foot inspections are critical. Dr. Franklin encourages patients to make it a routine every Sunday evening. Remove your socks. Check every part of your feet carefully, including between the toes and around the heels. If you notice a sore, crack, blister, or wound that does not noticeably improve within several days, do not ignore it. Early action can prevent far more serious consequences later. And while wounds reveal problems beneath the skin, the next sign is visible without even touching your feet. Changes in skin color around the ankles and lower legs may be quietly exposing circulation problems connected directly to blood sugar damage. Most people never realize what those color changes actually mean until it's too late. Why darkened skin, swelling, and cracked heels can signal hidden damage deep inside the body, and why some of the symptoms people blame on getting older may actually be warnings they should never ignore. One of the most dangerous things about diabetes is how quietly it changes the body. There's usually no dramatic moment, no sudden collapse, no flashing warning light forcing someone to stop and pay attention. Instead, the signs creep in slowly, blending into everyday life so naturally that most people never realize what they're looking at. And one of the clearest examples of this happens right around the ankles and feet. Many older adults notice darkening skin near the ankles or lower legs and assume it's simply poor circulation from sitting too much. Some describe a faint purplish tint. Others notice patches that look slightly brown, reddish, or uneven compared to the rest of the skin. Because the changes happen gradually, they stop standing out. People become used to seeing them every day. But according to Dr. Franklin, these color changes are often revealing something much deeper happening inside the blood vessels themselves. Blood vessels are lined with an inner surface called the endothelium. Under healthy conditions, that lining stays smooth and flexible, allowing blood to flow efficiently throughout the body. But chronically elevated blood sugar slowly damages that delicate surface. Over time, the vessels become stiff and less effective at transporting oxygen-rich blood, especially to the lower parts of the body that already struggle against gravity. The legs and feet begin losing the circulation battle first. Blood starts pooling in areas where it should flow freely. Oxygen delivery decreases. Nutrients arrive more slowly. And eventually, the skin itself begins changing color because the tissue underneath is no longer receiving what it needs consistently. Dr. Franklin compares it to an old garden hose left outside under the hot sun for years. At first, it still works normally, but eventually the material stiffens, cracks appear, and water no longer flows with the same pressure. The hose hasn't completely failed, but the damage is obvious if you know what to look for. The same thing happens inside damaged blood vessels affected by prolonged high blood sugar. Medical research has shown that lower leg discoloration is often present long before someone officially receives a diabetes diagnosis. In many cases, the body has already been struggling with circulation problems for years while the person remains completely unaware. That's why Dr. Franklin recommends a surprisingly simple daily habit. Every morning, while sitting in a chair, extend one leg forward and flex the foot toward your shin for several seconds before switching sides. These small ankle-pumping movements activate the calf muscles, which function like natural pumps that help move blood back toward the heart. It takes only a few minutes but can significantly improve circulation over time. But circulation changes aren't the only clue hidden in the feet. Another sign appears in the skin itself, and countless people spend years trying to treat it the wrong way. Dry, cracked heels are often dismissed as a cosmetic problem. Most people buy stronger creams, thicker lotions, or expensive treatments hoping the cracks will disappear. Yet no matter what they apply, the dryness keeps returning. That's because the real problem may not be happening on the surface at all. Inside the body exists a network called the autonomic nervous system. These nerves control functions people rarely think about consciously, including heartbeat, digestion, body temperature, and sweat production. Specific nerves regulate the sweat glands in the feet, helping maintain the skin's natural moisture balance. But when blood sugar damages those nerves, sweat production decreases dramatically. Without enough natural moisture, the skin begins drying from the inside out. The heels harden, tiny cracks form. Eventually, those cracks deepen enough to bleed or become painful. And no amount of lotion can fully solve the issue because the body's internal moisture system is no longer functioning correctly. Dr. Franklin describes it like a riverbed during a drought. The ground cracks not because the surface lacks rain for a day or two, but because the underground water source has dried up over time. In the same way, cracked diabetic heels reflect a deeper internal problem rather than a simple skincare issue. Research published in foot and ankle medical journals confirms that autonomic nerve dysfunction is common even during the pre-diabetic stage, often years before full diabetes develops. That means the body may already be experiencing nerve-related damage, while blood sugar numbers still appear only mildly elevated. To protect the skin, Dr. Franklin recommends creams containing urea, which help draw moisture into dry tissue more effectively than standard lotions. Wearing cotton socks overnight after applying the cream can also help the skin retain hydration. But he emphasizes something important to every patient. Treating the skin without addressing blood sugar is like repainting a wall while ignoring the leaking pipe behind it. The surface may temporarily improve, but the underlying damage continues. At this point, many people begin realizing something unsettling. Several of these symptoms may already sound familiar: tingling, burning, cracked heels, changes in skin color, and yet most people never connect them to blood sugar problems until much later. But the next warning sign may be one of the most overlooked of all because people assume it's completely harmless. Swollen feet and ankles are so common after age 60 that many stop paying attention to them entirely. The truth, however, is that persistent swelling may reveal that another major organ inside the body is already under stress. How the kidneys, nerves, and circulation system are all connected to what's happening in your feet, along with one symptom that doctors frequently misdiagnose for years before discovering the real cause. Swollen feet are so common in older adults that many people stop questioning them completely. After a long day, the shoes feel tighter, socks leave marks around the ankles. By evening, the feet look puffier than they did in the morning. Most people blame the weather, too much salt, standing too long, or simply getting older. And sometimes those explanations are true. Temporary swelling can happen to anyone. But according to Dr. Franklin, there's a major difference between occasional swelling and the kind that signals something much more serious happening inside the body. The warning sign appears when swelling becomes persistent, when the puffiness remains even after a full night of rest, when pressing a thumb into the skin leaves an indentation that lingers for several seconds. That type of swelling, known medically as edema, often points towards stress inside the kidneys, one of the earliest organs affected by long-term elevated blood sugar. Most people never think about their kidneys until something goes wrong, but these organs work constantly behind the scenes every minute of every day. Healthy kidneys filter massive amounts of blood, removing waste products while balancing fluid levels with extraordinary precision. Inside the kidneys are microscopic filtering units called nephrons. These delicate structures act like tiny strainers, deciding what the body keeps and what it removes. But high blood sugar slowly damages those filters. Over time, the kidneys lose efficiency. Fluid that should leave the body starts staying behind. And because gravity naturally pulls fluid downward, it collects in the feet and ankles first. Dr. Franklin often explains it using a simple image. Imagine a bathtub with a partially clogged drain. Water still escapes, but much more slowly than it should. If the faucet continues running, the tub gradually fills higher and higher. The same thing happens inside the body when kidney filtration begins declining. Fluid builds up because the system can no longer clear it efficiently. Health organizations report that nearly 1 out of every 3 adults with diabetes eventually develops diabetic kidney disease. What makes this especially dangerous is that the earliest symptoms are subtle. Many people notice swelling years before they realize their kidneys are under strain. That's why Dr. Franklin encourages patients to take swelling seriously instead of brushing it aside. One important step is reducing sodium intake. Processed foods, canned soups, frozen dinners, sauces, deli meats, and packaged snacks often contain far more salt than people realize. Excess sodium forces the body to retain water, making swelling significantly worse. Elevating the feet above heart level for even 15 minutes a day can also help improve fluid movement and reduce pressure in the lower legs. But while swelling points toward fluid imbalance, another symptom creates an entirely different kind of suffering because it feels sharp, sudden, and deeply confusing. Many patients spend years treating the wrong problem before learning what's actually causing their pain. Dr. Franklin remembers countless patients arriving frustrated after trying every possible solution for severe foot pain. They were told it might be arthritis, plantar fasciitis, bone spurs. Some received injections. Others bought expensive insoles or relied heavily on anti-inflammatory medications, yet the pain never truly disappeared. What makes diabetic nerve pain different is the way it behaves. The pain often arrives suddenly, especially at night. Some describe it as an electric shock shooting through the arch of the foot. Others feel stabbing sensations that seem to come out of nowhere while resting in bed. Unlike muscle pain or joint pain, this discomfort does not necessarily respond to standard painkillers because the problem isn't inflammation. The problem is nerve malfunction. Damaged nerves don't always stop working quietly. Sometimes they become hyperactive instead. Injured nerve fibers start firing randomly, sending intense pain signals to the brain even when no injury exists. The brain reacts as though the foot has stepped on something sharp, even though the person may be lying completely still under a blanket. Dr. Franklin compares it to a smoke detector with a dying battery. The alarm keeps chirping randomly in the middle of the night despite no actual smoke or fire. The sensor itself has become unstable. Diabetic nerves behave much the same way. They send false alarms that feel painfully real. Research in pain medicine journals has shown that painful diabetic neuropathy is frequently mistaken for orthopedic conditions during the early stages. In many cases, patients wait years before receiving the correct diagnosis. During that delay, nerve damage often continues progressing silently underneath the surface. This is why recognizing patterns matters so much. If foot pain repeatedly appears at night, feels electrical or burning in nature, and does not improve with ordinary pain medications, it deserves further investigation. Dr. Franklin often recommends discussing neuropathic pain specifically with a doctor because the treatments used for nerve-related pain are very different from those used for muscles or joints. He also notes that magnesium glycinate supplements, when approved by a physician, may help support nerve function and reduce symptom intensity in some individuals. But again, symptom management alone is not enough. Unless blood sugar itself is addressed, the underlying damage continues moving forward. At this point, the pattern becomes harder to ignore. The feet are revealing circulation problems, nerve damage, kidney stress, and even early organ dysfunction long before many people ever receive a diagnosis. But the next signs may be the quietest of all because they involve things most people barely notice in everyday life. Cold feet that never seem to warm up, hair disappearing from the lower legs, tiny physical changes that seem harmless on the surface but may actually reveal serious blood vessel damage underneath. Doctor explains why these silent signs deserve far more attention than most people realize, especially for adults over 60 who want to protect their independence and long-term health. Almost everyone over the age of 60 complains about cold feet at some point. It's such a common experience that most people laugh about it. They wear thicker socks, turn up the heater, or pile extra blankets onto the bed without thinking much more about it. But Dr. Franklin says there's an important difference between feet that occasionally feel chilly and feet that remain constantly cold no matter what you do. The patients who concern him most are the ones who describe a strange imbalance. Their hands feel warm, their body feels comfortable, the room temperature is perfectly fine. Yet their feet remain ice cold, even during summer or while sitting under heavy blankets. That kind of persistent coldness often points toward a hidden circulation problem known as peripheral arterial disease. To understand why this happens, it helps to picture the body's blood vessels as a giant transportation network. Arteries carry oxygen-rich blood from the heart all the way to the outer edges of the body. The feet sit at the farthest end of that journey. When blood vessels become narrowed or damaged, the feet are often the first place to suffer because they're the hardest area for blood to reach efficiently. Chronically elevated blood sugar speeds up a dangerous process called atherosclerosis. Over time, fatty plaque builds along artery walls, reducing the space available for blood to flow. The arteries supplying the feet are especially vulnerable because they're smaller and farther away from the heart than many other blood vessels in the body. Dr. Franklin compares it to an old heating system in a large house. The radiators closest to the boiler stay hot and comfortable, but the radiator all the way at the end of the longest pipe barely warms up because the flow has weakened before it reaches that point. The feet experience something very similar when circulation declines. Less warm blood arrives, so the tissue itself physically becomes colder. The American Diabetes Association reports that peripheral arterial disease occurs far more frequently in people with diabetes than in the general population. And one of the earliest warning signs is persistent coldness in the lower legs and feet.